Hello there. My name's Bryoni. What's your name? Oh, yes. How have you been? Okay. And what symptoms have you been feeling? Right. Okay. So you've been having headaches? Any migraines? These tend to be a lot more painful and last for longer durations. You can also feel nauseous. Have you been feeling any other way? Is it mainly just the pain? Right, okay. Is there anything else you think I should know about that may factor into why you're feeling like this? Okay, alright, well don't worry. I think I can make you feel better. What I would like you to do is just make yourself as comfortable as you can, okay? Now, I am going to be doing an examination, okay? Just a few things I want to check, make sure you're okay. I'll do a little bit of a test with your eyes, but not too much, okay? If at any point your headache gets worse or you get more pain, just tell me and I will stop, okay? There's a few things I want to rule out, a couple of things which I think it's important to check, alright? But at any point at all, if you need me to stop or slow down, just say, alright? Wonderful, okay. So I'm just going to pop some gloves on. Alright. Now, I'm just going to have a little feel around, okay? Please tell me if you have any pain or discomfort. I will pop a tiny bit of pressure just on your head like this. Just tell me if any particular parts are more sensitive or more painful, okay? Alright. How does this feel? Any changes to your pain? Any discomfort? Alright. Okay, well done. I'm going to just check your temperature. I want to make sure you've got nothing else sort of going on. just so we can get to the root cause. Okay? So, just gonna pop this here. Just gonna come a bit closer. Your temperature is 36.4. That's okay. It's not your temperature. I don't think you have a temperature. What I'm going to do, I'm just going to get you to pop your finger in here for me. Okay. This is an oxygen saturation meter, and it just tells me that you've got enough oxygen. So I need you to pop your finger in here like that. Okay. It's very clever. Just clip that in for me. Wonderful. Now it can take a few seconds just to register. Just take a nice deep breath in and out. Good. Take a nice deep breath in and out. Can you do one more? Deep breath in. Wonderful. Your oxygen saturation is 97%. I'm going to take that one off. Now, I do just want to check your pulse. So I just need your wrist. I'm just going to feel here, okay? Hopefully you've got a nice, strong pulse. Lovely. 1, 2, 3, Okay, it's about 76. Your heart rate is fine. Alright. How are you feeling? Alright. Is everything okay so far? It's not getting worse. Okay, good. Alright. So next up, I want to just check your blood pressure. Okay? I want to make sure that it's not low or high. This could also have a factor. I'm going to get my stethoscope just here. Okay, so I'm going to check it manually. Alright, it's a lot more accurate that way. Okay, so if you can, I need you to pop your arm in here for me. Okay, I'm just going to open it up. Just slide your arm in. Okay, just going to push that up, tighten it a bit. Wonderful. Okay, so I'm now going to be pumping it up. Alright? Now, first of all, I'm just going to feel for your pulse, just so I know how much to do it up by. So I'm just going to take your arm. Lovely. Okay. I'm going to pump this, okay? Lovely. Okay. We're just going to deflate that. Wonderful. Alright. I'm now going to pop this on. I'm just going to pop this up through the cuff a little bit. Just on your main artery there, so I can hear that. Wonderful. Okay, now I am going to pump again, and this will tell me your blood pressure, okay? Lovely, you're doing really well. Good. Perfect. Let's pop this down. I'm going to take this off. And we're just going to take that one off your arm. Just slide your arm out. Wonderful. Your blood pressure is actually 111 over 74. Slightly on the lower side, but I'm not concerned with that at all. It's only just slightly low. Okay. You probably might need some more. Have some fluid, some water, maybe something to eat. Okay. So after this, it's really important to have perhaps a glass of water. All right. And that might just take the edge off for you. You might be a little bit dehydrated. Okay. Alright, what I am going to do now, I'm going to check your breathing. Okay, so I would like you to take a nice deep breath in for me. And out. Good. Take a nice deep breath in. And out. Okay. Nice deep breath in. Out. Alright, well done. I'm just going to have a little listen. I am going to pop this one just here. Please breathe normally. Good. And then just here. Breathe normally. Okay, now if you can, take a nice deep breath in. And out. Nice deep breath in. And out. Okay, I'm just going to move this. Breathe normally. Take a deep breath in. And out. Wonderful. Your breathing is fine, it's clear, you're not congested or anything. That part is generally okay. Do you suffer with a cough or asthma? No, just your head. Okay. And how is your head right now? How is it feeling? Alright. Okay, well what I am going to do, I am going to check your eyes. Just a little bit, okay? I don't want to put too much pressure on them. It's usually a main cause for headaches or migraines. I think what I will do is request for you to have a thorough eye check. You may just need some new glasses, okay? just to make sure that nothing's going on. But what I would like you to do is just look here, look here, look here, look here, and look here. Good. Tell me when you can see my fingers. Good. 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 Well done. Good. Perfect. Now tell me when you can't see them, okay? Good. 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 Wonderful. Okay, now I would like you to look at my finger. Follow it with your eyes. Follow my finger. Tell me if your headache gets worse. Okay. Follow this finger. You're doing so super well. Well done. Perfect. Okay. What I would like you to do now is just read this eye chart. Okay? Tell me what this one is. Good. 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 I can see you struggling a little bit there, aren't you? Okay. I am going to try something. I do have a couple of lenses here. I do think you need a thorough check though, but I just want to see if this is going to make any difference to your vision, okay? Or if this reduces the strain on your eyes. How's this? Is this better or worse? Okay, what about this one? Better or worse? Okay. This one? Better or worse? And this one? Better or worse? Okay, interesting. I have got one more here. Okay, tell me, is this better or worse? Right. Worse? Okay. Are you ready? Better or worse? Okay. Better or worse? Okay. Those are the only ones I have. I am going to refer for you to get a thorough eye test. Okay? I'm also going to request for you to have a set of routine bloods done. Alright? But for the meantime, I'm going to do a couple of remedies just to try and ease that pain for you now, okay? The first one is, I want you to smell this for me. Now this is supposed to help with headaches and migraines. It's supposed to ease that for you, alright? Okay, just give this a smell. Make sure you get a good whiff. Good. One more. Good. Okay. Hopefully that takes the edge off a little bit, clears everything. Okay. Next up, I'm just going to use this. Okay. It's just going to be some relaxing sounds just to try and ease that pain. Okay. Just close your eyes if you prefer. You're doing really well. Perfect. Okay. Just got a cold compress here. Just going to pop this on your head, okay? Hopefully this just releases some of that pressure. Alright, so what I am going to do, I'm going to request for you to have a thorough eye test done, a routine set of bloods, okay? Now what I would like you to do is keep your fluids up, drink plenty of water, okay? And if it's still bad, come back to see me, alright? Okay. I'll take care. Bye-bye. 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 Oh, hello there. please come on in and make yourself comfortable. My name is Dr. Bryoni. That's it. You're right on time. So, can you tell me a little bit about what's been going on? Why you made this appointment? Right. Okay. And what symptoms have been occurring? Okay. Alright. Well, there are numerous reasons. Some simply could be dehydration, lack of sleep, that kind of thing. However, it can be more serious. I will do a few tests today of what I can do, and then I'll evaluate and see whatever things we can do. Okay? Perfect. Alright. I'm just going to pop some gloves on. I'm just going to put these gloves on just because I will be coming a little bit closer to you and I am going to touch you. Okay? Alright. Now, would it be okay if I just come a bit closer and just feel around your face and your head? Just around your ears and your jaw? Is that alright? Wonderful. Please do let me know if you have any pain or discomfort. Alright, that generally feels okay. Now, I'm just going to feel your shoulders and your arms, okay? To make sure everything's fine. Just do this arm. Any pain or discomfort in your arm there? Alright, now the other side. Any pain or discomfort? No. Perfect. Alright, I'm going to just touch your face, both sides at the same time. Let me know if there's any changes or if one side's more sensitive than the other. Okay? Okay. Can you just puff your cheeks for me? Good. Puff your cheeks. And now bring them in. And puff them. Okay. Clench your teeth. Okay. Can you just move your head from side to side and up and down? Wonderful. Any pain or discomfort? No? Alright. I'm now just going to use this tool. I'm going to touch your face with it. It should feel cold. If it doesn't, please let me know, okay? Touch. 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 Wonderful. Alright. Now I'm just going to check your temperature. So just look straight at me. 36.3. The temperature is fine, okay? Alright. What I would like you to do, I want you just to smell this for me. Let's get that a whiff. What does that smell like? Well done. That's perfect. Next, are you able to just read the side chart for me? Starting here. Good. Mhm. Lovely. Slightly harder. Wonderful. And what colour is this? Rectangle. And what colour is this one? Perfect. Good job. Okay. Next up, just tell me how many fingers you can see. How many? How many fingers? How many? How many? How many? Good. How many? How many fingers? How many? Okay. And would you say they're close to you? Okay. How about this? Close or far from you? How about now? How about now? How about now? Close or far? Close or far? Close or far? Close or far? Wonderful, okay. Just look at my finger. Now follow my finger. Keep following my finger. Very good. Keep following my finger. Alright. I'm just going to use a light. I'm going to have a little look into your eyes, okay? So just look over here for me. Good. Look at my hand. Do not look at the light. Do not look at the light. Look at my hand. Okay. Alright. Now look over this side. Do not look at the light. Look at my hand. Okay. Your eyes are fine. Could you just look up for me with your eyes only? Now look down. Look left. And look right. Okay. I'm going to use this light. Look at the light. Could you now follow the light? Just follow the light for me. Follow the light. Follow the light. Follow the light. Follow the light. Okay. Now, I'm going to check your memory. Okay. So what I would like you to do is just look at this chart, and I want you to remember as many as you can afterwards. I'm going to go through them, okay? Apple, flower, cat, bell, mug, cake, glasses, hand, rugby ball, a truck, whiteboard, sandwich, balloons, present, bird, magnifying glass, dog, pencil, 7, tree, flag, trumpet maybe, earth or the world, You can use your own terminology if you like. Have a little look. I'll give you 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Now, what I'd like you to do, just tell me how many you can remember. So, say them all now. Good. 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 Oh, yep, good. Try and do one more for me. Alright, you did really well actually. A little better than I thought you would. Alright, next I'm just going to check your blood pressure. Okay, so I've got a cuff here. Now, I do need you to pop your arm in for me. So, if you just slide your arm in that cuff there. Wonderful. Now, is that comfortable? It is. Okay. Then just relax your arm down. Okay. Perfect. So, I'm just going to hold your pulse on your wrist. I'm just going to pump it up just so I know how much to do it, okay? Feel for your pulse. There it is. Alright, I'm going to inflate the cuff. Okay. Let's deflate that. It's about 160 for you. Okay, I'm now just going to pop this in. Alright, I'm just going to pop this under the cuff there. Lovely. Okay, so just sit nice and still, just looking at the gauge. Alright. Okay, I'm going to pump it again. Lovely. Just going to deflate. Perfect. Wonderful. That is absolutely perfect. Your blood pressure is 120/80. That's completely perfect. Let's just take your arm out of there for you. That's it. Just slide your arm out. Lovely. Thank you. Okay. I'm now just going to check your oxygen saturation level. So just pop your finger in there for me. Wonderful. Keep your hand nice and still. Okay. Now, take a deep breath. Good. And out. Very good. Deep breath in. And out. Perfect. Alright, your oxygen saturation is 97% and your heart rate is 81. So that's absolutely perfect. Alright. Finally, I'm just going to have a little listen for your chest. I just want to make sure you're not congested. I want to make sure I can't hear any fluids or anything and that everything's nice, open and clear. Alright, so just sit back and relax for me. Just going to put this on your chest. Just that, breathe normally. Okay, just slow it down. Breathe normally, and just a bit lower. Breathe normally. Okay, I'm going to come around and pop this on your back, just turn slightly. Lovely. Good, I'm going to move that. Okay, I'm going to move it again. Lovely. Okay, I'm just going to pop this here. Now take a deep breath in. Good. And out. Good. Take a deep breath in. Out. Wonderful. Breathe normally. Okay, now do a cough. Perfect. Okay, well, everything sounds fine. It doesn't sound congested or anything. I'm generally quite happy with how everything has been today. Now, regarding your symptoms, like I say, I think it's more dehydration and lack of sleep. But I am going to request for you to have some routine bloods done. Okay, so you will receive a separate appointment for that from our phlebotomist. Okay. Lovely. Well, I don't want you to worry. You have nothing to worry about, to be honest. But I would like to just see your bloods, just to make sure they're okay. Yes. Alright. Well, take care for now. Alright, and we'll meet up soon. Bye-bye. Oh, hello there. Please come on in. Take a seat just there for me. My name is Bryoni. Could you just confirm your full name for me, please? Perfect. Wonderful. So I understand you're here for your yearly flu vaccine, is that correct? Wonderful. Alright, just confirm your date of birth for me. Lovely. So have you had the flu vaccine before? Okay, so the flu vaccine actually protects you against the flu, okay? Now the flu is a serious life-threatening illness, okay? And the vaccine just prevents you from getting the flu, but also managing the symptoms of the flu, okay? Alright. I don't want you to worry, you seem a little bit anxious. Is it the injection that you're worried about? Alright. Well, I have done a lot of these, so I want to kind of reassure you that you're in safe hands, okay? I know exactly what I'm doing, alright? And when we get to that part, you can look away and it will honestly be over within about 5 seconds, okay? Alright. Now I do just need to ask you some questions, okay? So, I'm just going to pop today's date for the vaccine. Okay. Are you completely well today? You're not sick? You don't have any flu-like symptoms? You don't have COVID? Okay. Have you had any adverse reactions, or do you have any allergies regarding vaccines or any allergies in general? Okay. Alright. Do you have any illnesses which may affect your immune system? Okay. Alright, let's just finish everything here. Okay. Alright. Have you ever felt dizzy, nauseous, or have you ever fainted while having any sort of vaccines or injections or anything previously? Okay. And is this because, you're anxious? Okay. that's everything I need to do on my side. Okay, I'm going to check a few things. I just want to make sure you don't have a fever or anything at the moment. I'll check that you haven't got a temperature. I just want to check a few things, and then I will give you the vaccine, okay? Wonderful. So I'm just going to check your temperature. Just look straight at me. Okay, it's 36.4. It's absolutely fine. And could you just pop your finger in here? I want to just check your oxygen saturation levels, okay? Just put that in there. That's it. It does take a few seconds to register. Just take a nice deep breath in. And out. Good. One more deep breath in. Out. Wonderful. So your oxygen saturation levels are actually 97%, and your heart rate is about 85. That's not that bad, that's good. Yes, so that's all done. Okay, I'm just quickly going to feel your pulse. I just want to check it manually. Okay, so just pass me your wrist. Hopefully you got a nice strong one. Lovely. Okay. 3, 4, 5, 6, 7, 8, 9, 10. Okay, I got about 82. That's absolutely fine. Okay, now I am just going to get everything prepared. Okay, please just compose yourself. I'm going to give you a couple of minutes while I get everything sorted. Alright? Try not to worry, okay? You're safe here with me. Just going to pop some gloves on. Alright, I'm now just going to prepare the injection, okay? Okay. Now I know this looks pretty daunting, pretty scary, okay? But you're gonna be alright. Take a deep breath in for me. Very good. Deep breath in. Okay. Please turn a little bit that way if you don't want to see. Okay. And I'm just going to grab just the top of your arm here. Okay. Just to make sure I get the muscle. Lovely. Okay. Do you want me to tell you when I'm going in? Okay. Okay. Alright. Take a deep breath in. Now. Good. Good, 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 good. A little bit painful. That's just a sharp scratch. Well done. Breathe out. Breathe normally. Okay. I'm just popping it in now. Just count to 5. 1, 2, 3, 4, 5. Good. Okay. I'm now just going to pull it back. Alright. Breathe in. Good. And breathe out. Well done. I'm just going to get rid of that in the shaft box. Let's have a little look at this. That's fine. I'm just going to pop a little bit of tissue on there. I'm just going to hold it. It's only tiny, you're not bleeding or anything. Just going to wait for that to stop. Perfect, I'll just leave that on there. It should stay. Lovely. Alright, I'm just going to take these off. How are you feeling? I just want to observe you for a minute or so. You did really, really well. I told you it wouldn't be painful. Usually when the needle goes in, it's always good to take a deep breath in, let it go in, and then just breathe normally, okay? It's just a little bit of advice. So I'm just going to... Wow. I'm just going to recheck your temperature. That's still the same. And how are you feeling? Any dizziness, lightheadedness? Any migraine? Do you feel a bit faint? Alright. You've done actually really, really well. What I would say, you are free to leave now because you're completely fine. If you would like to go back into the waiting area, there is a water dispenser there, so you can have a glass of water. And maybe just on your way home, just have something to eat, okay? And drink, keep yourself hydrated. Now you can get a little bit of sort of bruising, a little bit of pain, just where it's going to be quite tender, only for a day or so. You can take some paracetamol as soon as you get home, and you might feel a little bit tired. That's completely normal, okay? But if it goes red or quite sort of inflamed or anything, you need to get back in touch with us, okay? Good. Alright. Well, thank you so much. Honestly, you were fine. Alright. Well, take care. Bye-bye. Bye-bye. Okay. It's all done. My next vaccination in a couple of minutes. Oh, hello there. My name's Dr. Bryoni. What's your name? Wonderful. Please Come on in. Make yourself as comfortable as you can. Alright. Now, how may I help you? Mm-hmm. Mm-hmm. Right, okay. And have you had any other symptoms or experienced anything else that I may need to know about? Hmm. Okay. Your symptoms seem to be quite generic. There are numerous reasons why you may feel dizzy, have headaches. There could be a wide range of different things. I am going to do a few different tests on you today, if that's alright. Wonderful. Well, please just sit back, relax for me. Okay. Alright. So I'm just going to check your temperature first of all. This is one of the most obvious reasons. I'm just going to pop this up against your head. Okay, I'm just going to try that again. Your temperature is 36.6, so that's not the issue. Your temperature's fine. You don't have a temperature. What I am going to do, I'm just going to get you to pop your finger in here for me. Okay, this is an oxygen saturation meter. It will just tell me what your oxygen levels are. Okay, so pop your finger in there. Perfect. And just take a nice deep breath in for me. Good. Oh, that's at 100%. Well done. It says here your heart rate is 81, but I will check that manually, okay? Perfect. Take your finger out. Lovely. Alright. I'm just going to check your pulse, so I just need your wrist. Hopefully you've got a nice, strong pulse. Okay, I got 42, but I only did it for 30 seconds, so I would times that, and it was about 84. Now, your pulse felt regular. I didn't feel anything abnormal, so I can just assume it's 84, which is kind of aligned with the oxygen saturation meter, okay? Alright. Next up, I'm going to have a little look into your eyes, if that's okay. Now, I do have a light here. It is quite bright, so please tell me if it's too much for you, but do not look directly into it, okay? Just look somewhere over here. Alright. That's it, do not look at the light. That's it, keep looking over here. Okay, now look over this side for me. Okay. Could you just look up with your eyes only? got good pupil response. I am going to just use this brighter light. Could you just look at the light? Look at the light. 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 Okay, now follow the light for me, okay? I'm gonna move it. Just keep following it with your eyes. Wonderful, you're doing really, really well. Okay, your eyes look fine. I have an eye chart here. Would you mind reading it for me? From here. E, good. L, T, good. How about this one? H, very good. This one? Wonderful. Can you do this one for me? Very good. Okay, that's all I need you to do. You've passed on that one. Okay. Now I have one here which is numbers. What's this number? 9. This one? 5. Good. What's this number? 8. 7. 4. Good. Can you read this number? 2. 8. 4. 3. Very good. Well done. Okay, your eyes are generally okay. Just tell me when you can see my fingers, okay? Good. Good. Okay. Tell me when you can't see them, alright? Good. Good. Perfect. Well done. Okay. How many fingers am I holding up? How many? How many fingers? How many? How many? How many? How many? How many? Perfect. Alright. I'm just going to use this light. Open your mouth for me. Just want to check that your mouth is okay. And stick your tongue out. Alright. Could you just say ah for me? Ah, very good. Looks okay. It's not red or anything. I'm gonna get you to try a bit of this. Just taste it. Tell me what it tastes like, okay? Ready? Pop your tongue out. Drop. Drop. Just. What does that taste like to you? Good. Okay. Now I'm going to have a little look into your nose. If you just lift your head slightly. Don't look at the light. I'm just having a little look into your nose. Okay. Now just do this for me. That's it. Alright. Your nose looks fine. Could you now smell this one for me? What does it smell like? Good. You're really good at that. Okay. next I'm just going to check your muscles and everything, okay? So yeah, I'm just going to have a little feel around. Alright, I'm just going to start with your head. Just feel, let me know if you've got any pain or discomfort, okay? Okay, I'm just going to feel your shoulders. Okay, now your arm. Okay, and the other side. That's fine. I'm just going to feel your chest, okay? Kind of a bit of pressure on that. Any chest pain? Okay. I'm just going to come down and feel your tummy, okay? I'm just going to put some pressure on your tummy. Okay, just do a cough. Okay. That feels fine. Just move your head for me from side to side and up and down. Very good. Do a big smile and a frown. Can you wink? Good, okay. Now do a big smile and clench your teeth. Good, and stick your tongue out and move it from side to side. Perfect, that's all great. Okay, I'm going to have a little look into your ear. Alright, just want to make sure that everything's fine. Just turn your head slightly. Okay, I'm going to check the other side. Okay, your ears generally look fine. Just a little bit of wax in there, but nothing I'm concerned about. Okay, how is your hearing generally? Good? Alright. Yeah, I'm not concerned about that, no. What I am going to check now is your breathing. Okay, could you now just take a deep breath in with me? Ready? And out. Good. Deep breath in and out. Wonderful. Okay, I am going to have a little listen to your chest, alright? Okay. Just breathe normally for me. Okay, that's fine. I'm just going to pop it here. That's fine. I'm just going to come around and pop it on your back. And that's fine. Okay, I'm going to pop it here on your front. And just take a nice deep breath in. And out. Very good. Take a nice deep breath in. And out. Wonderful. That's absolutely fine. Your breathing is fine. There's no problems there. That's everything I'm going to check today regarding your symptoms, your dizziness, having a headache. I do think it might be down to the heat. I think you do need to drink some more, okay? And have plenty of rest. If you get any other symptoms of any kind, if you feel like you're going to faint, or if you do faint, then please do come back. But for now, take some rest, drink plenty of water, okay? and look after yourself, especially in this heat. Like I said, if your symptoms get worse or they don't get any better, please do come back, alright? Okay, well, take care. You know where I am. Bye-bye. Oh, hello there. Perfect. You're here to get your ears cleaned, is that correct? Wonderful. I'm going to very quickly try and fit you in, okay? Yes. Alright, well please take a seat. Make yourself comfortable, okay? I am just going to put on some gloves. Now, have you been getting any pain or discomfort? Okay. Any discharge coming from the ears at all? Alright. I'm just going to have a little feel around, okay? Do let me know if it hurts at all. Any pain? It does feel a bit tender around here. Alright. Okay. I am just going to have a little look with my light here, okay? Just in both ears. I just want to see what I'm working with. Okay? So if you could just turn for me and look in this side first. Alright, you do have a bit of build up in this side. I'm just going to check your other side, okay? Alright. Just want to get that right in there. Oh, yes. Okay, it's a little bit better this side, but still there is still a build-up of wax. Again, it's quite dark in colour. It looks quite hard. Yeah, okay. Alright, so I've had a bit of a look. You do have build-up in both ears. This side's a little bit better, but we do need to get that out, okay? So what I'm going to do, don't worry, it's not going to hurt you. I'm going to just soften it ever so slightly first, and then I'm just going to gently scrape it out, okay? But it's very gentle, I promise. So I am just going to use this first, just to give your ears a bit of a clean, just to get that surface layer off. This is just a wipe, okay? Okay. I'm just going to hold your head there. I'm just going to give this side a wipe. 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 Okay? And now the other side. Wipe. 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 Okay, that should hopefully soften it a little bit. Okay. what I'm next going to do, I'm just going to pop some drops in. Alright, I'm just going to pop this in your ear. Drop, drop, drop. Lovely. And now the other side. Perfect. Don't worry, it might come out slightly. That's okay. Alright. What I'm going to do, I'm just going to try and soften it here with my brush, okay? Okay, now the other side. Back this side. And the other side. Okay, I've scraped some of that. I'm now just going to use this. Just want to get those last few bits. Scoop, 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 scoop. The other side. Scoop, 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 scoop. And this side. Scoop, 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 scoop. And this side. Scoop, 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 scoop. Okay, alright. I'm just going to use this light. Just want to have a little look into your ears. Hopefully we've got it all. Okay, and now this side. Okay, one more little scrape with my brush. Scrape, 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 scrape. And now the other side. Scrape, 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 scrape. Okay. I'm gonna have a little look. Hopefully they're clean. Ah, yes. That looks great. Oh, good. And now the other side. Okay. Perfect. We've managed to get that out. Lovely. Wow, your ears are all nice and clean. Hopefully you can hear a little bit better. That should hopefully help. Okay. If they do build up, you might be quite prone to build up earwax. Just come back to see me. Alright? Perfect. I told you it wouldn't hurt and it wouldn't take long. You are welcome. Thank you so much. Bye-bye. Bye-bye. Oh, hello there. Please come in. Make yourself comfortable exactly where you are. My name is Bryoni. What's your name? Perfect. You're right on time. So just tell me why you're here Mm-hmm. Mm-hmm. Okay. And have you had any symptoms of any kind? In general? Mm-hmm. Okay. No, that's fine. I don't want you to worry. I don't think it's anything to be sort of seriously concerned about. But it's good of you to come here. Okay? So what I am going to do, I am going to give you a thorough check over. Okay? And we'll just see if you're alright. Wonderful. Okay. Well, please just sit back. Relax where you are. I'm just going to put on some gloves. Lovely. This one. Okay, so just before I begin, I just want to take just a moment just to see you. I just want to observe you, your structure. Just try and sit back for me. Does that hurt at all when you sit properly? Okay, no, that's fine. I'm just going to have a little feel around your shoulders. Do let me know if you have any pain or discomfort. Okay, I'm just going to feel down your arm, okay? Any pain or discomfort? Alright, now the other side. Any pain or discomfort? Okay, I'm just going to put some pressure on your chest and your tummy. Okay. Again, do let me know if you have any pain or discomfort. Just going to push, push, and now your tummy. Just cough. Lovely. Okay, can you just lift your arm? Good, on the other side. Good, can you just lift your feet a little up? So just move your legs. Lovely. Now can you just turn your head for me? From side to side. Any pain or discomfort? Wonderful, just lift your head up and down. Up and down. Perfect. Alright. I'm just going to have a little feel around your face, okay? Any pain or discomfort? Alright. Okay. I am now just going to have a little listen to your chest. Just take a nice deep breath in for me. Out. Take a nice deep breath in. Out. Wonderful. Okay. Just gonna pop this here. Just breathe normally. Okay, I'm just gonna move that. Okay. Keep breathing normally. gonna pop this on your back. Okay, breathe in and breathe out. Okay, breathe in and breathe out. Wonderful. It actually sounds okay. I'm not concerned or anything. Alright, sounds absolutely fine. Okay, what I am going to do, I'm just going to check your temperature. Just want to make sure you haven't got a fever. Just going to pop this here. And one more. It's 36.3, so you're actually okay. Alright. And I'm just going to pop this one on your finger. I'm just going to check your oxygen saturation levels, okay? And your heart rate. Just pop your finger in there. That's it. Wonderful. And just relax. Okay. That is 98%. And your heart rate 86. I'm happy with that. That's wonderful. Okay, what I'm going to do now, I'm just going to have a look at your eyes. Okay, so just look straight at me. Wonderful. I'm just going to fill here. Good, fill here. Okay, fill here. Okay, they feel okay. Could you just look here? Look here. Look here. Look here. Look here. Good. How many fingers do you see? How many? How many? How many? How many? How many? How many fingers? How many? How many? Wonderful. Tell me when you can see my fingers in your vision. Good. 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 Okay, tell me when you can't see them. Alright? Good. 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 Very good. Okay, blink. 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 Okay. Now tell me, are my hands close or far? Good. 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 Very good. Okay, now look straight at me. Look at my nose and tell me which side moves, okay? Which side? Good. 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 Very good. Well done. Okay, I'm now going to use a light. And I just want you to follow the light for me, okay? So look here. Just follow the light. Follow the light. Follow the light. Keep following the light. Good, you have a really good pupil response. Wonderful. Now I've got a brighter light here. Look at the light. Now follow the light. Just follow the light. Keep following the light. Very good. Follow the light. Follow the light. Wonderful. Good. Okay. Your eyes look fine. You've got a really good pupil response. I'm not particularly concerned. How do your eyes feel? Did that put a little bit of strain on them? Okay, just blink. Blink. Alright. I'm now just going to check your facial nerve, okay? So I'm just going to move your face a little bit. Okay. Now just smile. Frown. Wink. Wink. Can you open your mouth wide? Now puff your cheeks. Very good. Okay. That's fine. I'm now just going to touch your face. Tell me if it's sensitive, okay? Good? Okay. I'm now just gonna do that on your face. Tell me if it's sensitive, okay? Good. Okay. Now I've got a brush here. I want you to tell me if you can feel it on your skin. Okay? Ready? Good. 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 Wonderful. Okay. Next, I'm just going to have a look into your ears. Just want to check these are fine. So just turn your head slightly. Okay, now the other side. Now I'm just going to whisper in each side and just tell me if you can hear it, okay? Alright? Can you repeat it back to me, what I said? Wonderful. A, B, C, D, E. Repeat it back. Perfect. Okay. Book, pen, magnet. Good. Dog, mouse, cat. Brilliant. Okay. And lastly, I'm just going to check your sense of smell and taste. Okay. So just smell this for me. Give that a whiff. What does that smell like to you? Good. That's correct. I've got another one here. And I want you to taste this one now, okay? Ready? Drop. What does that taste like to you? Well done, that's correct. Okay. Well, I have checked pretty much everything. You seem absolutely fine. I think for you, you might just need to have a bit more rest. Okay. Drink plenty of water. Okay. And just try your best to relax. Okay. Just relax, relax, relax. Alright. Everything is going to be okay. Alright, well, take care. And I'm sure I'll see you soon. Bye-bye. Oh, hello there. Welcome. My name is Bryoni. Please, take a seat just in front of me. Make yourself as comfortable as you can. Okay. Now I understand you're here for a eye test and examination, is that correct? Wonderful. Okay. I'm just going to put some gloves on. Can you just tell me of any symptoms you've been having regarding your eyes? Okay. Right, okay. And any blurred vision, distorted vision, double vision? Okay. Do you ever see any sort of dots, black dots in your vision? Okay. Any redness in your eyes? Any watering? No. Okay. Alright. Well, I am going to do a third check. Okay? We'll have a little look at what's going on. Alright. Just sit directly in front of me. Now, I'm going to just have a feel around of your eyes. I just want to make sure there's no lumps or bumps or anything. Okay? Do let me know if you have any pain or discomfort. Okay. They look a tiny bit red. What I'm going to do, I've got a saline wipe. Yeah. Almost like a magic wipe. Now, because I'm going to be doing lots to your eyes, I don't want to overwork them and make them worse. So I am just going to clean them, wipe them. This should help, okay? Just so that you don't get sore eyes while I'm doing this test. So I'm just going to give them a bit of a clean. It's just clean saline on here, so it's not going to do anything. It's not going to sting. I'm just going to wipe, 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 now the other side. Wipe, 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 wipe. Tap, 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 okay, just blink, blink, blink. There you go. Okay, I'm now going to begin your test. Alright, so first of all, just look here, 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 look here. Okay, now just follow my finger with your eyes only. Keep following. Good. Follow my finger. Wonderful. Look here. Look here. Look here. Look here. Look here. Look here. Good. Tell me when you can see my fingers. Good. 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 Very good. Now tell me when you can't see them. Okay. Good. good. Okay. How many fingers am I holding up? How many? How many? How many? Good. 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 Very good. Okay, look straight at me. Tell me which side my fingers wriggled, okay? But look straight. Keep your focus. Which side? Good. Which side? Which side? Which side? Good. 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 Which side? Which side? Very good. Okay, just blink. Do your eyes feel okay? Good. I'm now just going to use a light. I am going to have a look into your eyes, but I don't want you to look at the light. I'm going to start on this side. So just look over here. Do not look at the light, okay? Do not look at the light. Good people response. Okay, I'm going to check this side. Look over here, okay? Do not look at the light. Do not look at the light. Okay. You've got good pupil response. Okay, very good. What I would like you to do now is just look at the light, okay? Good. 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 Very good. Okay. Now look up for me. Keep looking up. Okay, look down. next going to check your vision. I've got an eye chart here. Please, if you could just read this letter for me. This one. Very good. 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 Do the next one down. Is that difficult? Okay. I've got a lens here. I'm just going to place it over your eyes. Tell me if it's better or worse. Tell me if you can see this one. Okay. So is that better or worse with the lens? Better or worse? Okay. Try this way. Better or worse? Better? Worse? Okay. I'm gonna try one more. Okay. Better? Worse or worse with? Is it better with the lens? Let's try this one. Ready? Is that better? Worse? Is it better with? I think so as well. Okay. What I'm going to do, I'm going to measure for you to get some glasses. You could do with tiny. Yes, just maybe a 0.5 in both eyes. Yeah. What I'm going to do, I'm just going to pop this up. Okay. And I'm just going to measure for your glasses. Okay. Just gonna pop this here. Okay. So about 4 and 1. Okay, and then about 7 and about 10. Okay, that's fine. And I'm just going to measure your eyes just to get those measurements, just to double check. Okay, stay nice and still. Yeah. that's everything. Your eyes are generally okay. Your vision is probably just sort of adequate where it should be. But I think some glasses just with 0.5 lens will just give you that enhancement, and I think it will just put a little less strain on your eyes, and hopefully it can reduce your headaches. Yeah, but generally your eyes are fine, but there's no harm in just having some lenses. Yeah. Alright, well, thank you so much for coming to see me. Take care. Bye-bye. Yep. Oh, hello there. Yes, you've come to the right place. This is for your COVID booster vaccine. Wonderful, yes. My name is Bryoni. Just take a seat for me. I'll be giving you your booster. Alright. Wonderful. So I'm just going to check your file. Perfect, okay. Just tell me your full name. Yeah. And what's your date of birth? Yep. Wonderful. Just wait for that to load. Perfect. So I can see here. Yeah, that's fine. I'm just checking which vaccines you've previously had in general, just to check if the one that I'm going to give you today is beneficial to you, and just to check that you're not going to have any reactions. Do you have any allergies or anything I need to be aware of? Okay. And have you ever had any adverse reactions from any vaccines? Alright. So the COVID vaccine will significantly reduce your risk of severe illness, and it can actually help you to recover quickly, building up your immune system. Alright? Wonderful. So, just doing the final checks. It looks here that you can have the vaccine. Alright. Okay. So, which arm would you like me to do the vaccine in? So it will swell a little bit. I think I'm going to do this side just because actually you're closer to me here. Yeah, is that alright? Okay. It won't sort of bruise, but it might feel bruised. And you can also get a little lump sort of under the surface. That's completely normal. It might ache. You probably get an achy arm. What I would suggest is, as soon as we've done this, if you do feel any pain, then you can always take a paracetamol and that will just ease it for you, okay? But I don't think you'll have any other sort of reactions to it. Just take plenty of rest and drink plenty of clear fluids. Alright, so if we can just do this, just roll your sleeve up for me, okay? And the vaccine's just gonna go up here. Alright, I will need to pinch your skin and then I'll pop the needle in, okay? But it's not very big, so don't worry. I am just going to put on some gloves. How do you feel about vaccinations and injections in general? Okay, you don't have to look. You can turn away if you like, or close your eyes. So what I am going to do, I'm just going to clean your arm. Okay, so I'm just going to use this wipe. Okay, it's just an alcohol wipe. Okay, just going to clean the surface. Alright, I think that's clean. Just gonna let that air dry just for 10 seconds or so. Now I'm just going to get the needle ready. Just going to fill it. We need to do that should be enough. Okay, are you ready? You don't need to look. So I'm just going to pinch your skin. Okay. So just take a deep breath in for me. Deep breath. Big deep breath in. Ready? Now. Good. Sharp scratch. And breathe out. Very good. Breathe out. You're doing really well. Okay, I'm just going to take that out. Lovely. Okay. It's okay. I'm just going to hold it. I'm just going to use this wipe. I'm just going to dab it. Okay, it's not bleeding, but I am going to put a little plaster on for you, just to make sure. Okay, I'm just going to put that on your arm. Ready? Lovely. You've been ever so brave. How does your arm feel? Yes, I told you it wasn't going to be painful. It's always good to breathe in as it goes in and then breathe out. Yes, your arm looks absolutely fine. It's not red at the moment. Is it starting to ache or not yet? No. Well, it might start to ache in a couple of hours. In that case, please do take paracetamol, okay? Alright. I just want to monitor you for a few seconds, okay? Just want to make sure you don't feel funny. So, we've done your vaccine. I'm just going to update your file. Do you feel okay? No headaches? Do you feel dizzy? Okay. Okay, well, you are good to go. And like I said, if it does start to hurt, just take a paracetamol. Have plenty of rest. Your arm probably will ache, okay? And just make sure you stay hydrated and drink lots of water. Alright? Wonderful. You're most welcome. Come back to me if you need any other vaccines or anything, okay? I'm very gentle. Alright. Well, take care. Bye-bye. Bye-bye. So, COVID vaccine done. Oh, hello there. My name's Bryoni. Please come on in. Make yourself comfortable. I understand you're here for a memory test. Is that correct? You're not sure. What's your name? Okay. Yes, you're here for a quick memory test. Is that alright? Perfect. Okay. Well, to begin with, I am just going to be asking you some simple questions. Okay. Now, if you do struggle, it's absolutely fine. Alright. I will then be doing a little categorizing word association with you. Okay. And then I also have some sort of numbers that I'd get you to recall and some pictures. Okay. Sound good? It sounds fun, yes. Alright. Are you ready? Perfect. So, can you just tell me your full name? Okay. And what's your date of birth? Good. Can you tell me what year we're in at the moment? Good. And how about the month? What month is it right now? Good. Okay. Now, I'm going to ask you some sort of generic based questions. So if I said to you, what colour is the sky? What would you say? Right. The answer we're looking for is blue, of course. Okay, so these are just stereotypical colours for things, okay? So, what colour is a tree? All colours. Wonderful. Well done. Okay. What colour is this? It's blue. Wonderful. Okay. You did well at that. Alright. Now I'm going to do objects, okay? So, can you tell me the colour of a banana? How about the colour of a carrot? What about the colour of broccoli? What colour is broccoli? Okay. And what colour is a potato? Good. Okay. What colour is a tomato? Good. Alright. Now I would like you to describe an object for me the best way you can. Okay? So describe it in a way how you would describe it to somebody who wouldn't know what it is. So if I said to you, can you describe a book? So describe a book. What is a book? If I didn't know what a book was, How would you explain the idea of a book to me? Good. Perfect. Okay. How would you describe what a teddy bear is? Perfect. Okay. How would you describe a pen? What's a pen? Wonderful. Okay. Now, what I would like you to do is, can you name me 5 random animals? Any animals of any kind. Yep. Yep. Perfect. Well done. Can you name me 5 vegetables? Very good. Can you name me 5 fruits? Good. Very good. Well done. Okay. Next, I want you to name 3 things that begin with the letter S. 3 things that begin with S. Very good. Now can you do 3 things that begin with the letter T? Wonderful. Well done. Okay. Next up, we're going to move on to the picture round. Okay, so I have a bit of paper here with lots and lots of different things. Now, I need you to try and remember as many as you possibly can. Alright? So we have an apple, a flower, a cat, a bell, a mug, a cake, glasses, hand, a ball or a rugby ball, a truck or a van, whiteboard, sandwich, balloons, present, bird, magnifying glass, dog, pencil, 7, tree, flag, trumpet, earth, bicycle, and a book. Okay? Now, I'm going to give you some time to look at this. Okay? I'll give you 30 seconds. 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, I'm going to pop this down now, and what I would like you to do is just tell me some of the things that were on the bit of paper. I'm going to check your memory. Ready? Good? Yep. Well done. Good. Yep. Yep. Good. 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 Perfect. You actually did really well there. I'm going to stop you there. You've said more than enough. You are passing through this. So, I'm now going to ask you some questions based on this. Okay? Now I need you to respond fairly quickly, just for me to decide your thinking processes. So, which fruit is on this bit of paper? Good, an apple. Perfect. And what colour is the flag? Is this one? It's green. Well done. And how many balloons are there? 3. Well done. Perfect. Well done. Okay, next up I've got some colour pens. Now, these have all got special names. Okay? I'm going to do 7 because this is quite a tricky test, okay? It is designed to be difficult, alright? So, I'm going to tell you the colours and then we're going to go through them again and then you're going to tell me what they are, okay? So you need to really listen and focus. The colour of this pen is black, okay? This one's black. The colour of this pen is called Old Red. Old Red. Okay? The colour of this pen is Mauve Shadow. Mauve Shadow. It looks white, but it has a tint of purple. It's Mauve Shadow. This one is Pale Green Light. Pale Green Light. Then we have this one, which is Spring Dim Green. Spring Dim Green. Okay. Alright. This one is Raw Silk. Raw Silk. Alright. And this one is called Winter Night. Winter Night. Okay. Alright. Can you tell me what colour this one was called? If you can't, that's absolutely fine. Thank you. Okay, what colour was this one? Okay. What colour is this one? Alright. What colour is this one? Okay. Don't worry, you're doing okay. What colour is this one? What colour is this one? Okay. What colour is this one? Black. Very good. You did okay. Like I said, it is a very difficult test. I wouldn't expect you to get them all anyway. Alright. Now, I am going to now say a word, and I want you to say a word that connects to the word. So, for example, if I said doctor, you could say nurse or hospital. It's word association. Does that make sense? So if I said book, you could say reading or read or pages. Alright? Okay. So if I say the word country? What are you thinking? Good. What if I said kangaroo? Okay. What if I said sleeping? Okay. What if I said glasses? And what if I said car? Wonderful. Okay, so the last thing I'm going to do, I'm going to whisper in each ear, and then I want you to repeat it back to me. Okay. 1, 2, 3, 4. What did I say? Wonderful. Cat, dog, mouse, bat. Perfect. Book, heart, gloves. Okay. 5, 1, 2, 0, 7. Okay. 8, 6, 5, 1, 4, 7, 9, 2, 0. Okay. That was tricky. Yes. Alright. Well, everything looks fine with your memory actually. There are some tests that were designed to be tricky, but you passed all of the questions that you needed to. I'm not concerned at all about your memory, alright? However, if you do develop anything or you'd like a second opinion, it's always worth getting checked out again. Alright? Wonderful. Well, take care. Bye-bye. Oh, hello there. It's me, Dr. Bryoni. How are you doing? Okay. Good. Well, I've just come to do a little examination. No, you don't have to sit up. You can lie back where you are. Okay? Alright. Now I'm just going to ask you some questions. Okay? So just confirm your full name for me. And what's your date of birth? Perfect, thank you. Okay, so to begin with, I'm just going to ask you some questions just to see if you know sort of the whereabouts. Okay, so do you know where you currently are right now? Okay, good. And do you know what day of the week it is? Right. Can you tell me what year we're in? Perfect. Okay. You've answered all of those correctly. You're all fine there. Now I just want to ask you, how have your symptoms been? How have you been getting on today? Okay. Any dizziness? Okay. Any other problems with your eyes, your ears, your mouth, your nose? Any blurred vision or anything? Right. And how have your medications been working? You still taking them? Okay. Okay. Alright. Is there anything that you think I should know about? Anything extra? Okay. Alright. Like I say, sorry it's taken me a while to come around to you, but I am just going to do a quick check over just to make sure you're okay, and then you can get some more rest. Alright. Okay. Just going to put that there. Okay. So first of all, I'm just going to check your temperature. I'm just going to pop this on your forehead, okay? Okay, that's fine. It's 36.4, so that's alright. Okay. Next up, would you be able to pop your finger in here for me? Just going to pop it on. I'm just going to check your oxygen saturation, okay? Just pop your finger in there. That's it, well done. And it can take a moment or so. Let's have a little look. So your pulse is 80 and your oxygen saturation is 97%. Well done, that's really good. Alright. Okay. I'm just going to put some gloves on. Alright. I now just want to have a little feel around your face. I want to just feel your arms and your tummy. Okay. I just want to see if you've got any pain or discomfort. Okay. So I'm just going to come closer. I'm just going to have a little feel around. Okay. Do let me know if you have any pain or discomfort. Check the side. Okay, just gonna check your shoulders. Okay, your arms. Good. This side. Wonderful. Now I'm just gonna pop some pressure on your chest. Okay. Do let me know if you have any pain or discomfort. Okay. Now I'm going to come a bit lower. I'm going to pop some pressure on your tummy, okay? Okay. Can you just do a big cough for me? Cough. And one more. Any pain or discomfort there? Okay. Alright. What I'm going to do is now listen to your chest, okay? Before I begin, could you just take a nice deep breath in? That's it, deep breath in. And out. Wonderful. Okay, I'm just going to pop this on your chest. Just going to lift your top. Pop that under there. Yep, that's fine. I'm just going to move it. Good. Okay, I'm just going to come around your back. I'm just going to pop this on your back, okay? Okay, take a deep breath in for me. And out. Very good. Take a deep breath in. Okay, take a deep breath in and out. Perfect. Alright, well, everything sounds fine with your breathing. You're breathing quite well. I think you were a little bit congested, but the cough seems to help. So you need to keep drinking plenty of clear fluids, okay? Keep coughing to get it moving. Yes. Alright. What I am going to do, I'm going to have a little look into your ears, okay? So, just stay where you are. I'm just going to come here. Okay. Alright, that looks fine. Just going to check the other side. Yeah, that looks fine as well. Your ears are okay. What I am going to do, I'm just going to move my hands. Tell me which side you can hear the sound, okay? Ready? Which side? Good. Which side? Good. Which side? Which side? Very good. Perfect. Okay. Now what I'm going to do, I'm just going to touch your face and tell me if you can feel it, okay? Tell me if it hurts at all. Any pain or discomfort? Okay. I'm just going to come here. Okay, I'm just going to move your head slightly. Can you do a smile and a frown? Can you clench your teeth? Good. Can you stick your tongue out and lift it up? Okay. Alright, I'm just going to check your eyes. So, just got my light here. Just look here for me. Fingers. Okay, now look at this side. Come on, do not look at the light. Okay, could you just look up for me? And now look down. Okay, look that way. And look the other way. Okay, just blink for me. I know it's very bright. Just gonna open your eyes a little. Good. Okay, just look at the light. 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 Okay, can you now just follow the light for me? Follow the light. Follow the light. Good, keep following. It's a bit bright. Okay. You can just blink. That's it. Should calm down, alright? Okay, just gonna make some notes just while your eyes calm down a little bit. So your temperature is fine. Oxygen saturation's fine. Alright, good. Breathing. Clear. Activate. Pupil response is good as well. Okay. How are your eyes at the moment? Okay, I'm going to give them a little bit of a break. I am going to do some more with your eyes. That might be one of the issues. What I am going to do, I would like you to smell this for me. Okay, is that a whiff? Oh, okay. What does that smell like to you? Good job. Well done. Okay. Now I'm going to lie to you. I'm just going to look at your nose, okay? You can close your eyes if you want to. Could you just do this for me? Do it again. Very good. Okay. And now just open your mouth. And just say, ah. Okay. Now stick your tongue out. That looks fine. Alright. Now, I am just going to do some movements with my hands. I just want to check your eyes. Okay, just for a couple more things. Alright. And then I will leave you be. And you can get some rest, okay? So, just look here. 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 Okay. How many fingers am I holding up? How many? 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 Very good. Okay. Can you now just follow this finger? Follow my finger. Wonderful. Keep following. Follow my finger. Good. Follow my finger. Okay, follow this finger. Very good. Okay. What I would like you to do, I would like you just to read this eye chart for me. Okay? What's this one? Good. This one. Good. Good. Can you do this one? Wonderful. How about this one? Perfect. You do the bottom two. Wonderful. You've got very good vision. Just tell me, what colour is this? And what colour is this one? Perfect. Alright. Well, I think you're doing really well at the moment. I'm just going to finish up writing your notes. Okay? Vitals are fine. I think you just need some more rest. Clear fluids. We're going to keep an eye on you, okay, for one more night. Hopefully you sleep well, you don't have any more issues, okay? But I will be monitoring you, okay? Alright. Well, take care, okay? If you need anything, just give me a call, okay? I will be around tonight, alright? But for now, you can just close your eyes and get some more sleep, okay? Alright. Well, good night.